Happy evening, viewers. A very warm welcome to another episode of GarbhaSandesha, episode number 32. And today's topic, as was picked out of the viewer's choice, it is for people with low or nil sperm count, ways to attain parenthood. In other words, we are going to provide solutions for men with low or nil sperm count. And to talk on this subject, we have two doctors on the panel. And this is a sort of sangam. One is from north and one is from the tip of the south. Like, why I'm telling this is that you people can ask questions both in Hindi and Malayalam. The first doctor would be Dr. Priyanka Rani, who is a fertility specialist with years of experience in gynecology and obstetrics. She holds a fellowship in reproductive medicine from Rajiv Gandhi University of Health Sciences. She is well versed in all ART procedures. Her skills as a fertility specialist made her a valued member of the team at GarbhaSandesha IVF Center. Next, we have Dr. Nidaa Ashfaq Ahmed Khan. She too is a fellowship in reproductive medicine from Rajiv Gandhi University of Health Sciences. She has also published many articles in international journals. To her credit, Dr. Nidaa has won a lot of awards at various national and state conferences and CMS. Dr. Nidaa is a renowned experienced fertility specialist gynecologist, rendering her services in GarbhaSandesha IVF Center as a consultant fertility specialist. Now, I would start with Dr. Priyanka Rani, madam, with the first question. Madam, what are the symptoms in men with low or nil sperm count?
Very happy evening to all the viewers. So many people who come to our walk into our clinic, they come and they just walk in like normal couples. They most often, in majority of the cases, there will be no symptoms of having a low or a nil sperm count. Just like in any other disorders where we can have some symptoms, here it is almost completely hidden, and in very few cases where if the veins in the testes are swollen, they may have testicular pain, or if there is a genetic component, they may have some other features of the genetic disorder or any other associated feature, but majority of the times there are no symptoms.
Okay, madam. Next question would be to Dr. Nidaa. Madam, how can low or nil sperm count be diagnosed?
Happy evening to all the viewers. So usually the low or nil sperm count is diagnosed first with a semen analysis when the patient comes to us first. So low sperm count is less than 15 million per ml, and absence of any sperms in the ejaculate is called as Isospermia, and low sperm count less than 15 million per ml is called as Oligospermia. So it can be diagnosed on a semen analysis when the patient comes to us first.
Okay, madam. Thank you. Dr. Priyanka, what is, as mentioned by Dr. Nidaa, what is oligospermia?
So azoospermia is when there are no sperms in the ejaculate. And as Dr. Nidaa said, we have to do a semen analysis. It is a very simple test. So for diagnosis, it is important that the patient goes and does a semen analysis, and just one report is not sufficient, and we cannot label a person as not having any sperms. So once we get a report like this where we cannot see any sperms in the ejaculate, we need to repeat it, because it may be due to many other factors, like if the patient is on some medication, or they're having fever, or maybe they have not given the sample only correctly. Maybe most of the sample has got spilled out. So those factors need to be considered before we label the diagnosis as azoospermia. So we must repeat the semen analysis after a month. And if there are any factors which can be corrected, those need to be corrected, and then we must do an analysis. So in both the cases, to say that the sperm counts are very low or it is zero completely, we must repeat it.
Priyanka, madam, there is a question, but this question is in Kannada. Could you manage Kannada?
Yes, definitely.
Yeah. The question is madam, small sac anta helidru, after 7 weeks no cardiac activity ಅಂತ DNC ಆಯ್ತು. ಸ್ಮಾಲ್ ಸ್ಯಾಕ್ ರೀಸನ್ ಏನು ಮೇಡಮ್ ಆಫ್ಟರ್ IVF?
ಸೊ ಇದಕ್ಕೆ ತುಂಬಾ ಕಾರಣ ಇರಬಹುದು. ಸ್ಮಾಲ್ ಸ್ಯಾಕ್ ಅಂದ್ರೆ ಅದು ಪ್ರೆಗ್ನೆನ್ಸಿ ಕರೆಕ್ಟ್ ಆಗಿ ಬೆಳೀತಾ ಇಲ್ಲ ಅಂತ. ಅಂಡ್ ತುಂಬಾ ಸರಿ ಮೇನ್ ಕಾರಣ ಇರೋದು ಭ್ರೂಣ ಸ್ಟ್ರಾಂಗ್ ಇಲ್ಲ ಅಂತ, ಅಥವಾ ಭ್ರೂಣದಲ್ಲಿ ಏನಾದ್ರೂ ಕ್ರೋಮೋಸೋಮಲ್ ಪ್ರಾಬ್ಲಮ್ ಇರಬಹುದು. ಸೊ ನಾವು ಇಬ್ರು ಕಪಲ್ದು ಜೆನೆಟಿಕ್ ಅನಾಲಿಸಿಸ್ ನೋಡ್ಬೇಕು, ಅಥವಾ ಬೇರೆ ಏನಾದ್ರೂ ಫ್ಯಾಕ್ಟರ್ಸ್ ಇದೆಯಾ. ಕೆಲವು ಸಲ ಭ್ರೂಣಗೆ ಕರೆಕ್ಟ್ ಆಗಿ ರಕ್ತ ಸಂಚಾರ ಬರಲ್ಲ, ಅದರಿಂದ ಕೂಡ ಕೆಲವು ಸಲ ಸ್ಯಾಕ್ ಬೆಳೆಯಲ್ಲ. ಅಥವಾ ಬೇರೆ ಏನಾದ್ರೂ ಎಂಡೋಕ್ರೈನ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇರ್ಬೋದು, ಅವ್ರದ್ದು ಥೈರಾಯ್ಡ್ ಸರಿ ಇಲ್ಲ, ಅಥವಾ ಶುಗರ್ ಕರೆಕ್ಷನ್ ಸರಿ ಇಲ್ಲ, ಅದರಿಂದ ಏನಾದ್ರೂ ಇರ್ಬೋದು. ಮತ್ತೆ ಕೆಲವು ಸಲ ಕರೆಕ್ಟ್ ಆಗಿ ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ತಗೊಂಡಿಲ್ಲ, ಪ್ರೊಜೆಸ್ಟ್ರಾನ್ ಸಪೋರ್ಟ್ ಕರೆಕ್ಟ್ ಆಗಿರ್ಬೇಕು, ಅದು ಕೂಡ ಕಡಿಮೆ ಇದ್ರೆ ಕೆಲವು ಸಲ ಪ್ರೆಗ್ನೆನ್ಸಿ ಬೆಳೆಯಲ್ಲ. ಸೊ ನಾವು ಎಲ್ಲ ರಿಪೋರ್ಟ್ಸ್ ನೋಡ್ಬಿಟ್ಟು ಹೇಳಕ್ ಆಗತ್ತೆ ಅದು ಏನ್ ಕಾರಣ ಅಂತ. ಬಟ್ ತುಂಬಾ ಸರಿ ಎಲ್ಲ ಕರೆಕ್ಟ್ ಆಗಿದ್ರೇನು 40 to 50% ಅಲ್ಲಿ ಎಕ್ಸಾಕ್ಟ್ ಕಾರಣ ಹೇಳಕ್ಕೆ ಕಷ್ಟ ಇರುತ್ತೆ.
Thank you, madam. That was a fantastic answer, and your attempt in Kannada also. So you are suggesting the patient to come with the entire reports and then get herself, the consultation done with you. Okay. Thank you, madam. Dr. Nidaa, what are the other parameters that can be assessed on semen analysis?
So there are several other parameters which can be assessed on semen analysis other than the count. So the next parameter is the motility. So normal motility is around 32%. Of progressive motility of a sperm is 32%. If it is less than 32%, we call it as Isospermia. And the next parameter which we assess on our semen analysis is morphology. So the sperm has a normal structure which we see. So we need at least 4% of the sperms to have a normal structure. If it is less than 4%, we call it as Stereoisospermia. And we see other parameters like vitality. So we see how many live sperms are there, how many dead sperms are there. So all these parameters are taken into account to see what is the next line of management for a patient.
Thank you, madam. Priyanka, madam, what are the causes of azoospermia?
Before I go into the causes, just one thing I wanted the viewers to understand is semen test is or semen analysis is a very simple test. Most often it is done in most of the pathology labs, but those are done by technicians who are not experienced in giving correct reports. So to get a correct report, it is very important that they do in a center where andrologists or trained technicians do it. And the other thing what I've noticed in my practice is there are people, especially in the peripheral parts of Karnataka, they come down where the wife would have been evaluated multiple times, every possible things would have been done, but a basic semen analysis would not have been done. And the entire, with the our society structure and the social structure is such that most often the wife is blamed for everything. And basic semen analysis would not have been done. So whenever we are looking into this problem of infertility, it is important that both of them are equally analyzed. All factors are taken into consideration, and then only we should proceed for treatment. Because I've seen sometimes even wives undergoing multiple cycles of taking tablets, even injections, without even a sperm analysis. So that doesn't work out. And in such cases, we realize it was Isospermia, where there were no sperms only. So that factor is something which must be considered always. Even for general practitioners who are giving medications, they should keep this in mind. And coming to the question, like what are the causes of Isospermia or low sperm count? It could be any infection like mumps or any other infection which was acquired, which has affected the male genital tract. It could be due to some injury, because testis is an exposed organ. Most of our internal organs are inside the abdomen, protected by muscle and skin. Here it is just a skin layer which is protecting. So any trauma can also damage the testicles, and some tumors or certain drugs can also affect the sperm counts, like people who are on antidepressants or antipsychotic drugs. Some patients may be taking medications for high BP. And even off late, we have seen in some patients, though it is not documented exactly in reports, post-COVID also some patients are coming back with relatively lower sperm counts. So, and sometimes even genetic factors. In about 20-30% of the patients, there'll be some genetic reasons for having a low or a nil sperm count. So we need to analyze everything in detail and then we'll be able to find out what is the cause.
Thank you, madam. And Dr. Nidaa, what is the role of TRUS or scrotal USG in evaluation?
So yes, we after a patient is diagnosed with a abnormal semen analysis, say a patient's count is less, or there is isospermia, or there is less motility, or morphology is not good, we usually ask for the next level of investigations. So such investigations are a scrotal ultrasound or a rectal ultrasound. So the importance of an ultrasound, especially a rectal ultrasound, would be that we can visualize the seminal vesicles, prostate, and the ejaculatory ducts. We can make out if there is any abnormality in those, or if there's any cyst or any obstruction in those areas, and why the semen is not able to come out. If there's any, that is usually done to rule out any obstructive causes. And we also do a scrotal ultrasound, basically to look for the volume of the testis, which is most important. So volume of the testis normally should be more than 15 ml. Less than 15 ml usually points us towards the abnormal spermatogenesis. So these are two types of ultrasounds which are done in azoospermic or oligospermic patients.
Thank you, madam.
To add one thing, like even the ultrasound, scrotal ultrasound gives us a lot of information about varicose, especially if it is not of an advanced grade. And very often we see men with relatively lower sperm counts having varicose. Though grade 1 and 2, we don't do any treatment, but grade 3 and 4 varicose can be detrimental to the sperm quality as well as the numbers. So ultrasound will help us in identifying even that.
And the next question is coming to you. What are the importance of post-ejaculatory urine analysis? Priyanka, madam.
So there is also condition like when we come across 0 or low sperm counts, there are 2-3 things which we need to analyze. As one thing, as I was saying, they might not have given the sample correctly, or in some men, what happens, especially for taking certain medicines, the semen, instead of coming out, tends to go back into the urinary bladder. So when that happens, usually they might come with a complaint of having a whitish urine. So we need to ask for that complaint, and many times what we do is when we get the semen report as 0 count, we usually centrifuge it. That is, we run it many times or rotate it multiple times at a very high speed and try to find out whether there are any sperms which are hidden. That condition is called as cryptospermia. So when we see that, okay, there are 1 or 2 sperms which are showing up a little later, in those cases, we usually suspect that probably the semen is not completely coming out and it may be going in as well. So when we analyze the urine of such men, so usually after ejaculation, they are asked to ejaculate and that sample is analyzed. In addition, the urine is also analyzed. And if we find sperms in that, that would suggest that probably it is going in the reverse direction, and then that has to be addressed in a different way.
Thank you, madam. Dr. Nidaa, is genetic screening required in patients with azoospermia and oligospermia?
Yes, absolutely. Genetic screening is required in patients with low sperm count or nil sperm count, because there is increased incidence of these genetic abnormalities in such patients. So if you see a patient with normal semen analysis, the incidence of genetic abnormalities is only 1%. But when you come across a patient with oligospermia, that is less sperm count, the incidence of genetic abnormalities increases to 5%. And when we go to azoospermia, the incidence increases to 15%. So it is best to do a genetic screening of the patient. So genetic screening in the sense we do a karyotyping of the male partner and few molecular genetics. So molecular genetics are to know whether the patient has any problem in the Y chromosome. When a part of the Y chromosome is deleted, patients can also present with azoospermia in such cases. So we usually do genetic screening in such patients.
Thank you, madam. Priyanka, madam, is endocrine evaluation necessary in patients with oligospermia and azoospermia?
Yes, again, as I was saying, there are multiple things which can be responsible. And all hormones are related to our hypothalamus and pituitary. So any endocrine variations, like if the sugar is altered or the thyroid levels are altered, that will impact the spermatogenesis in a large way. So these are very simple tests, like testing for sugars, thyroid, prolactin levels. So we must do it when, especially when there are symptoms of it, we must do it definitely. And most often in our general analysis, for males, we do the thyroid evaluation, and I've seen it has really made a lot of difference for many people. There was a couple who walked in where they had tried treatments for 2 years. They had gone to multiple clinics, taken treatment, nothing seemed to work out because they had just done a basic semen analysis and they were told that semen counts are relatively okay. It was done in a general lab. So it was not a very detailed report, but they were told everything is relatively fine. When we did an evaluation, the TSH was very high, and 1 month of treatment with thyroid hormones, the next month she conceived without treatment. So it can make that amount of difference. So it's very important that we check for the endocrine causes, and they are very easily correctable, and it will bring about a lot of change in the sperm count. So it is definitely worth doing it.
Thank you, madam. Dr. Nidaa, are there any risks involved in treatment of low or nil sperm count?
No, I would not say there are any risk involved in such treatments because these are very safe treatments done under supervision of the IVF specialist, andrologist, embryologist. So I don't think so there are any risks. Yeah, but patients should understand there might be a genetic factor behind such low counts. So best is to go with genetic screening in future. So I don't think so there are any risks involved with such procedures.
So men with low sperm count or nil sperm count can, approach IVF specialist,
yes,
and be advised that there is no risk involved whatsoever. Thank you for that answer.
Wanted to add a few more things here.
Please, ma'am.
Come across conditions of low or nil sperm count. There are 3 ways in which we treat them. First is with medical treatment, that is, we just give them medications which will help in improving the sperm count, which will help in improving the quality of the sperms, which is usually antioxidants is what we give, and there are other medications. We look into the drug history, whether they are on any drugs which can affect the sperm counts. So we need to change all that and see whether that is improving. Many times lifestyle changes can also bring about a lot of difference. Like recently I had a couple where even IUI had failed because the sperm counts were so low. The husband was going through night shifts and he was extremely stressed out with that. He changed his shift and within 2 months they conceived naturally. So the difference can be very drastic. So it may look very menial and it may not look very significant, but those things are all to be considered. So when we treat them, it's medical treatment plus lifestyle modification. And when none of these work out, over a month, we see how much of improvement is happening in the sperm parameters. And if there is an improvement, we proceed with similar lines. Otherwise, we usually we go ahead with the surgical procedures, which is PESA and TESA. PESA is percutaneous epididymal sperm aspiration, and TESA is testicular epididymal sperm aspiration. So here, just a small needle is passed into the testis or the sac where the sperms are stored, and we can retrieve the sperms. So very simple procedure. They can just walk in and walk out at the same time. No anesthesia, nothing is required. There's no bleeding, none of the risks are involved. So they need not be scared about any of the treatment. And those are the second line of treatment. Most often we first do the medical management, lifestyle management, and then go for the surgical methods.
Thank you, madam. That was a very comprehensive answer. Now, I would like to remind our viewers that across all centers of Garbhagudi, a special offer is running. The first free fertility consultation is being offered. I request all of you to avail this as it ends by end of this month. Now, moving on, my next question would be to Dr. Nidaa. I think Priyanka madam is already, encompassed this question, but still, if you would like to add, I will add a few things. What are the different treatments modalities with which we can attain pregnancy in a patient with oligospermia?
Yeah, so there are different treatment modalities. So as told by ma'am, antioxidants and lifestyle management is the first line of management, following which we go for surgical retrieval. Before that, we in oligospermic patients, we can attain pregnancy with different modalities like IUI, IVF, or ICSI. So this totally depends on the count and motility of the semen analysis at that particular time. So when the total motile count of a semen sample is more than 5 million per ml, the patient can definitely go for an IUI. If it is between 1 to 5 million, then they can go for an IVF. If it is less than 1 million, they can go for an ICSI. So this it totally depends on these parameters, and also it depends on the female factor also. So if we need to evaluate the female as well. If the female is totally normal and there is no tubal factor, if everything is okay, and the post-wash count is more than 5 million per ml, then this is an oligospermic patient, so they can go ahead with an IUI. So IVF is required when it is 5 million. That's it.
Thank you, madam. Madam, can we do IUI with surgically retrieved sperms? Priyanka, madam.
When we do a surgical retrieval of sperm like TESSA or PESA, as I was mentioning, first of all, we don't get too many sperms. The number of sperms is relatively less, and most often the maturation of the sperm happens through the entire tract from which the sperm goes through over a period of 1 to 2 months, and that is when it comes out in a mature state. So we rarely use the sperms for IUI because of lack of maturity and lack of numbers, but there have been instances where if we get good amount of sperms, it can be used, but those are very rare instances. In majority of the cases, we don't do IUI with the surgically retrieved sperms.
Thank you, madam. And Dr. Nidaa, I think you already covered this, but still, would you like to elaborate on is IVF ICSI required to achieve pregnancy in Isospermia?
Yes, definitely. IVF or ICSI would be the preferred treatment modality in such patients who have Isospermia, because we usually retrieve the sperms surgically. So in such patients, we don't have the enough amount of spermatozoa which we can use for an IUI also. So yeah, so IVF or ICSI would be a better choice for such patients.
Thank you, madam. Priyanka, madam, like if at all you would be asked to conclude today's topic, what would be your take for the conclusion?
One thing I want all the viewers to understand is it is not a very big problem. It is easily correctable, and there are management options, and we do come across instances where couples have been directly told no sperms, so go for donor. They have tried donors, IUIs, that has also failed, and then they've come back and had a baby of their own by doing PESA and ICSI with PESA. So there is an option. It is not very complicated. It can be easily done. And they have to consult the right people. The correct evaluation has to be done, whether it is genetic or whether it is things which can be correctable. Most often we have been able to achieve pregnancies with that. So the right advice at the right time in the right place has to be done, and then the pregnancy can be achieved. It is not a major thing which we come across. Though, like if 10 men come with infertility to our clinic, one of them might be having Isospermia. So it is not so common in the general population. 1 in 100 men may be having Isospermia, but among infertile men, it is relatively common, and it has to be tested in the correct place and diagnosed correctly. And with treatment, pregnancy is possible, especially their own genetic child is a possibility in such men. So they have to be hopeful and come for the correct treatment.
Thank you, madam. Dr. Nidaa, your conclusion on the topic, please.
Yes, so it's very important to, access treatment at the correct time. So today we had a patient who has done a semen analysis in 2009, which said Isospermia, and after which they have asked a few doctors, and they have said go for adoption, and they have adopted a boy child who's 10 years old, and today they have come. Both are almost 36 years old, and the female partner's ovarian reserve is less. So just that if they had come a little earlier and had a timely intervention, they could have their own genetic child. So it's very important to consult a proper fertility specialist at a right time and, go ahead for the treatment.
Thank you, madam. With that, we complete with our set of questions. I would like to remind the viewers again that there is an offer going in all our 5 centers across Bangalore. First, free fertility consultation. Please do avail that. And then if you have a suggestion for next topic, please do mention it in the comment box and send it to us so that our doctors will be able to speak on that. And that's all we have time for today.